do it again. Hello, my name is Debbie Clay, and I will be speaking today about fall prevention. Falls are a leading cause of non-fatal injuries and trauma-related hospitalizations in the United States, and have been linked directly with the quality of nursing care in a hospital setting. Research suggests hospital falls can be significantly reduced through quality hourly rounding, properly completing fall risk assessments, and targeted interventions for high-risk patients. Quality hourly rounding has been shown to reduce falls by as much as 39% and call light usage by 36%. Hourly rounding should happen between 6 o'clock a.m. and 10 o'clock p.m. and between the hours of 10 o'clock p.m. and 6 a.m. every 2 hours. During the hourly visits, the nursing staff should focus on the 4 P's: potty, possessions, positioning, and pain. Do the patients have to use the toilet? Is everything they need within reach? Are they comfortable? And are they in pain? By focusing on these 4 items, nurses can reduce call light usage and ensure the patient has all of their needs met. Each time the nursing staff enters the room, they should be evaluating the room for safety concerns and informing the patient when they will be returning. By following this protocol, patients will have a reduction in anxiety because they will know when you'll be back. Assessing for fall risk is also important. The most commonly used fall risk assessment tool is the St. Thomas's Risk Assessment Tool in Falling Elderly Inpatients, Stratify. Stratify rates fall risk on a 0 to 5 point scale, 0 low risk, 5 being high risk. And the questions assessed are: is there a recent fall history? Is the patient agitated? Is the patient visually impaired? Does the patient need frequent toileting? And does the patient transfer? How does the patient transfer? How much assistance do they need? Do they have assistance devices? How many people will it take to get the patient from one point to the next? Any patient that is found to be a high-risk category should have interventions in place to promote safety. Some of the main interventions are fall alert signs that alert staff that the patient is a high risk, high-low beds in use, scheduled toileting, supervision while in the bathroom, walking aids within patient's reach, and chair and bed alarms in use. Studies show that toileting is a leading cause of falls, with one study showing 42.5% of falls attributing to toileting. On this graph here, it shows the relationship between toileting and falls. As you can see by the chart here in red, falls while related to toileting constitute 45% of all hospital falls. Of that 45%, shown over here in this graph, 16% are happening when the patient is ambulating from the bed to the toilet or from the toilet back to the bed. And the act of getting in or out of the bed is 13%. Slipping off the toilet or commode is 10%. And transferring from the bed to the bedside commode and back, so just going from the bed to the bedside commode and then back into the bed, is 5%. And then another 1% of falls happen while using a urinal, trying to sit or stand to use it. Studies also show that identifying patients as high fall risk alone did not prevent toileting falls. Timely hourly rounding and consistently assessing the toileting needs is imperative. Research also suggests hospital falls can be significantly reduced through quality hourly rounding, properly completing fall risk assessments, and targeted interventions for high-risk patients. Quality hourly rounding will put patients at ease and give nursing staff the opportunity to inquire of each patient's needs with the 4 P's: potty, position, possessions, and pain. Properly completing a fall risk assessment will help identify who is at risk, and targeted interventions for high-risk patients such as timed toileting is a necessity and will specifically target 45% of all falls. Are there any questions?
Yes. Besides nurses, who else can help prevent falls?
Besides the nursing staff, we have physiotherapists that are also capable of helping. They work on improving gait and balance and they assist the patients in becoming steady on their feet. We could also do home visits, and this is when a patient's leaving the hospital and ready to go home, a healthcare professional can go to the home and assess the home itself for falls, and hopefully move away some of the items that cause them in the home. Any others?
Yeah, what is the importance of preventing falls?
Falls by patients have many consequences for the patient and the hospital. For the hospitals, there's an increased length of stay and increase in healthcare cost. For the patient, there's an increased fear of falling, loss of independence, physical injury, and even death. Thank you very much.
I got one more question, actually. What are some of the factors that lead to falls?
Some of the core factors include staffing and time of day. And other key factors include being male and certain cognitive functions such as anxiety, impulsivity, dementia, short-term memory loss. These factors go on to include medications such as sedatives, opioids, and diuretics, fatigue, fall history, gait problems, increased toilet needs, and visual impairment. Syncope episodes also are a major factor. This is not a complete list, but it includes the most predominant causes.
Thank you for answering my questions.
Thank you.